What's your Hogwarts house?
Oh, Ravenclaw. My name is Allison Holgerson. I'm a clinical assistant professor and director of clinical training in the Department of Clinical and Health Psychology.
Thank you so much for coming out on the day of the eclipse.
Yes.
I like to start these by doing a little bit of a rapid fire.
Okay.
First question, coffee or tea?
Coffee. 100%. Ooh, cake.
What kind?
Oh gosh, any. Really? Probably red velvet though. A good carrot cake.
Cats or dogs?
Oh no, both. I have both and I can't decide. Probably dogs have a slight edge.
So if you could think back to a time when you were in undergrad or graduate school, if you had to give yourself a superlative for how you were as a student, what would it be?
Thinking back to undergrad and grad school, I think it served me really well, but I was very focused on my studies. And sometimes I wish I just had fun more. So that's not a superlative though.
Most likely not to have fun.
Most likely not to have fun. I mean, I had fun, but I just wish I had, spent a little bit more time of just enjoying things more day to day and in the moment.
What inspired you first to go into psychology?
I had kind of a roundabout path. I started as an education major here at the University of Florida, so I did my undergrad here as well. And just really fell into Psych 101 class, really loved it. Then began doing research with Dr. Perry, former Dean Perry, in weight management, and that just really sparked my passion and interest of combining health-related interests and the psychology piece, and that led me to where I am today.
But part of your work includes working with patients undergoing bariatric surgery.
Correct.
What is the biggest myth about weight loss that you'd like to know?
Oh, that it's willpower. That if you just try a little bit harder, do a little bit more, we're a little bit more disciplined, that it would unlock this key, and that's just not it. Weight and weight management are incredibly complex medical conditions, or obesity is, and so many people struggle with their weight in so many different ways that are outside of their control. And so I would think just externalizing a little bit and let people know that, it's not just a matter of willpower or working a little bit harder, that you really need to draw on support and many factors that go into it.
Your work really shows the importance of taking care of your mental health in addition to your physical health. Can you talk a little bit about how you work with other healthcare professionals and why this type of collaborative care is essential?
Absolutely. So we really coordinate with the surgery team, but really any physician on the team of my patients to help them understand the many different ways that psychological health can impact physical health and vice versa. And am I taking my medications? Am I avoiding doctor's appointments because I'm feeling worried? Am I not taking my medications because I'm feeling down? And really, we can strengthen each other's work by working together. And thankfully, in my training, and especially in the last 5 to 10 years, I think there's been a lot more coordination between psychologists and healthcare providers that has just really advanced our patients' growth and understanding of their own ability to manage their healthcare.
What is the most memorable experience from your career? Is there something that a patient has said or a student has said that has really stuck with you?
There are so many. There are moments where patients have really taught me things that I wasn't expecting, but have eventually helped me be a better clinician. And of course, patients who share their appreciation, which always makes you feel good and empowered and validated in what you're doing. So I think there's so many times that happens in unexpected ways too, that I can't pinpoint one. But as far as kind of advising students and training, I think in supervision, you have those moments where it might just kind of click for a trainee and they're like, oh, I can do that with a patient, or I had this win with a patient. That's really rewarding. And so I really try to remember those to keep on going.
And if you could leave your students with one piece of advice that they would remember throughout their career, what would that be?
It all gets done. Some days it feels like your to-do list is insurmountable, or the next step is insurmountable, whether it's licensure or board certification. Everything gets done at some point. If you just take what's the next right thing that I have to do, it will just help you break things down and make you enjoy what you're doing even more.
All right, and is there any last thoughts that you want to share, anything that you want to shamelessly plug?
No, just that I am probably going to invest in a hammock now after my first rodeo in one. I get it. I get the hammock life now, so I will do that. I do, yes.
All right, thank you so much, Dr. Holgerson.
Thank you.